Hi there, it's Justin Lubino with Senior Advisors. And I want to create this short video just to cover some highlights of a recent report that was issued by the Office of Inspector General within HHS, which is Health and Human Services, specifically about Medicare Advantage plans and denials of service related to prior authorizations and just payment denials. Okay, before we jump into the actual report and the highlights, just wanted to quickly touch on this individual who may have read the report or maybe just tired of seeing these commercials we seem to see on TV every other hour with a former celebrity, for example, presenting highlights of Medicare Advantage plans. And a lot of people don't realize what's going on with those commercials, right? There's all these great benefits, whether it's a dental benefit or vision benefit or rides to the doctors. And essentially what those highlights are in those commercials are discussing things that are in Medicare Advantage plans. So it's a different type of Medicare coverage. And what we're going to highlight in this video is this recent report that just came out, and it discusses some potentially concerning things with these Advantage plans as it relates to those denials I mentioned earlier with prior authorizations and payments as well. So before we jump into the report, though, I just want to give you a little bit of background and framework on what is Medicare Advantage, okay? Because we have other videos that go into a lot more detail on this, but for the purposes of this video, just want to give you a little bit of framework so you understand some of the highlights in the report. When you go on Medicare, you really have an option to go with either Original Medicare, which is the left side of this diagram, or a Medicare Advantage plan, which is the right side of the diagram. You can't do both of these at the same time. You can only do one of these two paths. The left side of the diagram, if you go with Original Medicare, you're still getting, it's called Part A, hospital coverage, and Part B, medical coverage. You're getting that from the government. It's still administered by them, and you go to all Medicare participating providers and so forth. Most of these people enroll in if you go with the left side, enroll in a prescription drug plan, Part D, and then a Medigap or Medicare supplement plan. So that's one option you can take. The other option, and it's becoming more and more popular, probably because of some of those commercials and the marketing around it, are these Medicare Advantage plans. Those are the fully privatized plans where the insurance company takes over and fully manages your benefits for you. So they bundle the hospital, the medical, and the drug coverage into those plans generally, okay? So you can only do one of these at any given time. This report and the highlights we're going to talk about in this video are specific to the Medicare Advantage plans, okay? So let's discuss the methodology within the report, right? What did they do to determine, they're really trying to figure out if these prior authorizations and the payment denials are justified in the Medicare Advantage world. And so they took this sample of data. It was 1 week's worth of data from June of 2019. They looked at the top 15 largest Medicare Advantage organizations, and they got all that information, and they basically took a random sample of denials for prior authorizations, 250, and 250 denials of payment. And the random samples out of that week's worth of data. And they used healthcare coding experts as well as physician reviewers when necessary to review that data and see if these denials were justified. And some of the highlights in this report, I think there's some headlines out there in the news about this report that I don't think they're touching on this, which I think is an important highlight. The vast majority of these requests for prior authorizations and payment, just payment requests getting approved, do get approved. So 95% of the prior authorizations are getting approved, and about 90% of the payment requests are getting approved. Okay, so what are we looking at? We're looking at those that were declined. About 5%, which is about 1.5 million prior authorizations were denied, and about 10% of the payment requests were declined. So that's kind of what we're looking at. Now, out of that declined volume, was it justified, right? Should they have been declined? And now here's the highlight I think that we're seeing in the headlines and what's concerning a lot of people. Out of those that were declined or denied for prior authorizations, about 13% essentially should not have been denied. So it met the Medicare coverage rules, and that 13% of the prior authorization should not have been denied. And then out of the payment requests, almost 20%, came out to 18%, should not have been denied. They met the Medicare coverage rules. So these are the percentages that are of concern. Now, they seem out of 100% like relatively small numbers, but when you extrapolate those out over all of the folks that are on Medicare Advantage plans for a full year, so if we take that 1 week's worth of data and extrapolate it for a full year, it comes out to about 85,000 prior authorization denials that shouldn't have been denied. Again, that's just an estimate. And about 1.5 million payment denials that should not have been denied on those Medicare Advantage plans. Okay, so this is kind of the net impact to the Medicare beneficiary if they're enrolled in those Advantage plans. What were the top 3 impacted areas that were getting denied that should not have been denied? Imaging services was the top one. That has to do with things like MRIs and other advanced imaging where the insurance company said it wasn't necessary yet or it didn't meet certain criteria when it didn't need to meet or it already met that criteria, so it shouldn't have been denied. So that's one big bucket. The second one has to do with post-acute care facilities. So think of this like you're in the hospital for a stroke or a knee replacement, hip replacement, and you're getting transferred from the hospital into a skilled nursing facility. And that bucket of care, if you will, and those different levels of facilities was another big impacted area of services that get denied on these Advantage plans. So people that have Advantage plans that have trouble getting the necessary skilled nursing care or getting things approved by their insurance company for that skilled nursing care. And then the third one is injectable medications, which can be very costly. With original Medicare, those are covered under Part B as in boy. And with the Advantage plans, they're generally covered about 80% if they're approved. So the third biggest bucket of impacted areas in this study were these injectable medications that were getting denied that they shouldn't have been. So those were the main impacted areas. I have a few samples here in the slides, but you can actually go to the full report from the link on the first slide I showed. And there's a whole appendix in there that has all of the examples in there. Obviously, there's no personally identifiable information in the report, but it just gives you an idea of what are these situations that are getting denied that shouldn't be. And these are 2 examples of prior authorization. I'm not going to read through the whole detail, but the first one has to do with an individual who was trying to get a walker. He needed a walker to help him get around, and because he was given a cane within the last 5 years, the insurance company was declining the walker. And after further review and the study that was done here, the individual should have gotten the walker approved. It's a different device, obviously, than a cane for a different medical need. And that was one example. The other example here has to do with an MRI that was getting declined, and it should have been approved because it was for someone that had a lesion and it didn't meet, according to the Medicare Advantage company, it didn't meet certain requirements for the MRI. But after further review in this study, it certainly should have met the requirement, and they should have gotten the MRI without any issues. Here's a couple of payment denial samples that were in the report as well. The first one has to do with a situation with one of those skilled nursing facilities and not getting the right level of care and the right payment for the skilled nursing facility, which should have been covered. And the second example on this slide has to do with another situation with, this is with another type of test that was already pre-authorized and approved, and then when they went to actually get payment for the service after they did it, it was being declined. They weren't going to pay it. And they said it because it wasn't pre-authorized. This was a system issue or human error. Clearly it was pre-authorized, and the provider in this case had to send them a screenshot showing it was pre-authorized, and then the insurance company paid it. So a lot of the situations on the payments actually fall into that category around human error and system error. So what are the key recommendations that came out of this report for CMS? So CMS is Center for Medicare and Medicaid Services. That's the group that basically regulates these Medicare Advantage organizations. And the 3 main recommendations for them, the first one was to issue new guidance on the appropriate use of these medical necessity reviews. So in other words, provide some clarity. Right now, the language is pretty high level, says something like, your rules can't be any more restrictive than original Medicare. But the guidance or the recommendation out of this report is to provide more clarity around that to hopefully reduce these types of issues going forward. The second one is to update CMS's audit processes for these Medicare Advantage organizations to hopefully identify some of these issues and prevent them from happening in the future. And then the third one is another form of audit where CMS is going to be directing these Advantage companies to update their own internal audits to identify and fix these issues before they grow to the percentages we saw in this report. So those were the main three recommendations that were sent to CMS. CMS did respond, and it's actually in the appendix of the report. You can see the letter from the head of CMS where she acknowledges these three recommendations and indicates that they're going to implement to improve the Medicare Advantage plans going forward. So that's a positive. Hopefully, we do see some improvement and less complaints and so forth, less denials that shouldn't be denied for these Medicare Advantage plans. So I hope this video was helpful. Again, just wanted to provide that quick summary of that report. It's getting some news out there, and wanted to highlight some of those things that were in the report. We are a Medicare general agency. We do offer all kinds of Medicare plans. So we offer Medicare supplements and Medicare Advantage plans. I will say the vast majority of our clients do go with original Medicare and a Medicare supplement. Some of the reasons for that you've seen in this video, some of the concerns with potentially prior authorizations and managed care with those Advantage plans. But we do offer them, so if that's a direction you're interested in, we can offer those Advantage plans and the Medicare supplements and the Part D prescription plans. So I hope you found this video helpful. If you did, you can subscribe to us on YouTube, follow us on Facebook to get all of our latest updates related to Medicare. I hope you have a great day. Thanks.